Well, how many hours do you spend each week staring at the mirror at your face? I'm sure all of you ladies out there have done this, and probably some guys as well. The march of time can be cruel, and while some signs of aging are unavoidable, there are ways to maintain control. So joining me today with a series of segments on the aging face, we have Dr. Ann-Therese Stubbs with Ann-Therese Aesthetic Medicine. So welcome, Dr. Ann.
Thanks for having me.
So this is a great topic for us because so many women and men are becoming kind of aware more these days of their signs of aging. So there are two basic processes that you kind of say happen.
Yes,
when you age.
Everybody goes through the same things when they hit about 40, 50, and genetics, of course, has something to do with it. Some people don't have these changes as soon as others, and some people may even see some of these changes in their 30s. But basically, there's a descent. There's a descent of all the skin kind of downward. We lose a little bony volume in the mandible or the jawbone, and we lose volume in all the areas of the face. So we get kind of this descent of the skin, and we also get a deflation. So they have fat pads that might have been nice and plump in the cheeks, and in the temples and in the area right by the ear. And when those fat pads are nice and plump and full, they hold all the skin up. And then when as we age, they kind of start to deflate slowly. And then the skin tends to sag.
And we can see, of course, Mick Jagger went through a little bit of aging, you can tell.
He's a perfect example of, you can see in his youthful face all the volume in his lips and his cheeks, and the skin was, turgor was very good, and you can see the kind of rotational descent of the skin coming downward. His face went more from a triangular shape to kind of a boxy shape, but all that skin kind of comes downward. And that's what people object to.
And you mentioned descent. That is one of those. So that is kind of the falling of the face, isn't it?
Exactly. And so that's kind of what we were going to focus on a little more today, the descent of the skin. And like I said, you can see this in this diagram here, somebody in their 30s, 40s, 50s. Just the skin kind of descends downward. It creates more folds. So you can see the folds right by from her nose down to the end of her lips. Those are called nasolabial folds. Those get deeper because the skin kind of falls. And also I get a lot of women and men in my office complaining about jowling. So that skin that used to be up near our high cheekbone is now down around the jowl, and that makes people feel like they're getting kind of a heaviness or a jowling around the mouth or by the lower face. And then some of that actually makes the neck a little baggier too. So all of that descent as we're aging brings the skin downward, and so that's why there's been a big push to let's find some things that are non-invasive, the lasers, the radio frequency technology, the thermage, things that lift or tighten the skin back upward.
And I was surprised to hear you can actually lose bone, not just, loss of fat or volume, correct?
Exactly, very true. And so that's an interesting fact. Right around the orbital rim, or the hollow of the eye, that orbital rim or bony rim gets bigger as we age. So the eye hollows out. People say, oh, I look a little saggy or I have bags. Well, it's because that bone, they've lost bone there and they have more skin just kind of sitting there. Same thing with the mandible or the jawbone. We lose actual volume there. So we're actually getting kind of a receding chin as we age, and that's why there seems to be more skin. We didn't grow more skin. It just looks kind of saggy or jowly there because of the bony loss.
So loss of bone, loss of fat as well, that kind of all goes together to form that descent, that look.
Exactly, and that's and it sounds like we're being very negative here, but the positive side of it is there are really great technologies out there to kind of lift back up without the need for surgery.
And let's look, now that we're super depressed about how old we're going to get, there are ways to slow the progression. You talked about the jowls, the stage and the extent of drooping. So let's look at a before and after picture of this to see what can be done for these issues.
That's, I think, the positive way to go here. Basically, there's a lot of different things we can do. This gal had what's called a laser neck lift, and it's just a tiny little pinhole incision right under her chin, and we run a laser right under the skin, and we melt the fat that's accumulated on her neck. We also run the laser right along the jaw underneath the skin, and we can get some tightening because the laser heats the skin and causes the skin to build more collagen and tighten back up where it was maybe 5-10 years ago. So it's a very subtle look, but it's definitely a difference for this gal because she got some tightening in her neck and just a little less of the jowling there. It doesn't look like everything's kind of hanging downward. She really just wanted to look more like she did 10 years ago. She didn't really want the pulled tight look of a facelift. She just wanted a little bit of that bagginess gone and the tightening of the neck.
And the best part is, as always, you give us a great deal. If somebody wanted to come in, first, it's complimentary for the consultation.
Always, because patients never really know what they want. There's a great deal of technology out there, so we always offer a complimentary consultation. We sit down with people and go through what are their concerns, look at maybe a picture of them 10 years ago. So a lot of times patients will bring that with them. And then basically we're offering 20% off on our laser neck lift, easy for me to say, huh? And 20% off on thermage as well, which is one of the radio frequencies, just deep heat externally to tighten the jawline and the neck area.
Okay, thank you so much, Doctor, and as always for being with us.
Well, thanks for having me.